of that. This is the agenda. I'm going to talk about why MIPS is important, what some of the regulatory updates are, in particular focusing on the 2 transition years, 2017, 2018, and then go through some of the mechanics of the MIPS scoring and the different performance categories. Towards the end, I'll also delve into the advanced payment models, alternate payment models, and then give a checklist of action items and a summary. So first of all, what is MIPS? Stands for Merit-Based Incentive Payment System. It's one of 2 tracks of the Quality Payment Program, QPP. There are also the alternate payment models, which represent the other track. The whole thing is created by MACRA, which was a law passed with bipartisan support in 2015. And what's very important to understand is it's not going away. It has nothing to do with the Affordable Care Act, nothing to do with Obamacare repeal. MIPS is the most widely used term, and it's often misused to refer to the program as a whole, and that's okay. We can deal with that ambiguity. MIPS and then specifically APMs were intended by Congress to rein in rising Medicare costs, and we're in a historic transition from the classic fee-for-service model for reimbursement to a value-based reimbursement model that shifts more power from the professional to the payer. So that's instead of the provider specifying the fee to be paid, the payer will pay what they determine the services are worth. The payer measures several categories of performance, such as quality of care and cost of care from the point of view of the payer, and they'll be providing value-based reimbursement amounts calculated from those measures relative to the fee-for-service schedule, which is going to still continue to exist. So it's still not a full value-based reimbursement model. It's still a relative to one. There is still going to be an annually updated fee-for-service schedule. MACRA requires those payment adjustments to be budget neutral, and so their actual hope for decreasing Medicare costs is to shift as many of the healthcare providers over to what they call alternate payment models as possible. So that'll put more risk onto the healthcare provider. This is really pretty much the key slide that everyone needs to be aware of. The challenge of MIPS has to do with the difficulty to get a positive or at least neutral payment adjustment out of it. And the statistics, the analysis from CMS in the original proposed rule for MIPS, which hasn't really gone away, is still true, that it's slanted towards very large healthcare delivery organizations. Small practices simply lack the economy of scale to manage MIPS effectively, and MIPS has a disproportional effect on ambulatory specialties such as ophthalmology, which is what we're dealing with at Eye Care Leaders specifically. You'll see the shocking numbers that solo practitioners, 87% of them are expected to get a negative payment adjustment under MIPS. For small group practices, size 2 through 9 providers, it's approximately 70%, and it doesn't look pretty until you get to 100 or more providers in the size of the healthcare delivery organization, and with that sort of enterprise size, starting to be enterprise size organization, 81.3% of them are expected to get a positive payment adjustment. This is the key information that you need to keep in mind throughout the presentation. So there's been an update because just last week CMS published a proposed rule for 2018 MIPS. I'm going to